afternoon, everybody. Are y'all ready for the next session? You almost don't need a mic in here, but with me and with Steve, we probably wouldn't need a mic. But I'm going to go ahead and introduce our next speaker. This is the third time, he's fourth if you count one for the experts, time that he's spoken. Obviously, he's a guy that steps up to the plate when needed. This is Dr. Steve Fadum. He's a nephrologist in Houston, Texas. He's been an active member of the AAKP board for many, many years. He's also co-chair of our medical advisory board. He's editor of Renal Life and Kidney, the Home magazine. I mean, every one of them, all the magazines we do. And he is, like I said, just a good guy who steps up when needed. And this is the second time in 2 days that he's had to fill in for another speaker who had to get home because of the issues with the hurricane. So we're very happy that he is so versatile and he's done so many presentations before and he can do just about anything. So let's give him a warm welcome.
Yeah, I hope that everything is okay for my colleagues and friends who did have to go back home on the East Coast because it can be pretty scary. We've gone through hurricanes in Houston many times. And of course, AAKP is centered in Florida, and we've had many hurricanes there too. So. Well, I want to welcome you all. Little Rock is a beautiful city. Even from our window, this is the view, and it's just a gorgeous place, and it's very nice to be here. I want to talk about effective ways to communicate with your healthcare team. And Tejas Desai started these slides, and I finished them. And I agreed with Tejas about 90% of the time, and but there were some things that I learned along the road. I'm quite a bit older than him that I also want to share with you. I apologize that one of our Peabody doctors, we could probably shut the light. Come in on my breaking hip. How's that one? We have, yeah, there. Okay, well, this is one of our mallards out there, and he was just kind of looking at me, communicating in his own way. I go away so I could, probably afraid a little bit. But anyway, why is communication important? And communication is important for our psychological and emotional well-being. It really makes it important for us to be able to share our feelings, and sharing them is critical when you're sick, because not only do you have the feelings that we always have just with everyday life, but we have the additional burden of having an illness that makes us confront the fact that we're not in the type of health that we once were or would like to be in. So needless to say, being able to communicate, being willing to communicate, being effective at communicating is very, very important. The medical reasons why it's important are that, number one, the better you communicate, the better your relationship is with your doctor. Patients who never say a word to me, I have no idea what they're thinking. And not saying a word is the same as saying, how are you today? Fine. Keep the headphones on when you pass them in the dialysis chair. They're watching television, and you're asking, how are you doing? Fine. Okay, that's not communicating. And you sort of get out of it what you get into it. When you talk to a doctor, and the doctor is going to be more responsive to you if you talk to them than if you just fine. So it's important that you say, hey doc, I just wanted to ask you this, or I want to say this. These are my concerns today, and I want you to address this problem for me. So you've got to have that initiative that you're going to talk to your doctor. The second thing is your outcomes are going to be better. People who communicate, who understand what they're doing, are going to be sharing their ideas. The most common cause for medical errors are people who you give a prescription to who don't ask the question, what is that pill? And I want to hold my mouth right when he takes my picture. Usually looks like they take your picture and you look like stuff, and that's how you know, so if he's going to take my picture, I do a lot of photography myself. So. Go ahead and take it. Okay, very good. That'll probably be one of them they use. I had one guy take about 20 pictures once, and every one of the guy's mouth, he was a good-looking guy, but his mouth was really talking to him. So the other thing is less medical errors. You know, if somebody says, "Doctor, did you mean to give me, you wrote down here nitroglycerin, but the pharmacist gave me dynamite. Are you sure that you wanted me to do?" "Oh, no, that's a mistake." You know, and there are so many things, you know, "Oh, I wanted you to be on 0.5 milligrams, not 5 milligrams. So just showing your doctor the prescription and talking to them, you can create a barrier to medical errors. And of course, medical errors are common, and they're more common when people are older or when they don't express themselves. So this is another thing. And the third is better care. Overall, your care will be better. And the most important reason why is we all want to do the right thing. I mean, when I go up to a patient, I say, "You need the hepatitis vaccine." I say, "No, I don't." I said, "Well, what exactly is it about hepatitis that you would really enjoy having? You know, is it turning yellow, the loss of appetite? I mean, just help me understand it." And then after you explain to them that they give it to babies, the World Health Organization said that everyone in the world should get it, that it's perfectly safe, that it's not made with the virus anymore, it's all kind of attenuated, it's not going to hurt you to get it. People say, "Oh, nobody ever explained it that way," and all of a sudden they take the shot. So we have there's always one person in the unit that won't get it. They say, "I don't want you to have 100% vaccination rate or something." But just about everybody we talk to, you know, they get the vaccination. And the reason is that we don't just say, "Hi, I'm Dr. Fadum, and I'm a doctor, and, you know, I'm wearing a white coat, and I'm standing up, and you're sitting down, and I'm looking down on you, and I'm probably smarter than you, and you need your vaccination." And they probably won't get it when you act that way, when you give them that kind of attitude. But when you share with them the information, why you're doing something, that's when people do it. And there was a very interesting situation where a patient fell and they hit their head, and the doctor said, "You need to go to the emergency room." She said, "I'm fine." And so she said, "Well, you're not fine. You need to go to the ER." But he never explained to her that she could have bleeding into her head, and that bleeding could expand, and that she could die. And, you know, so it was criticized pretty heavily for that reason. And so this is something that you want to be aware of as a patient, and if you're in the healthcare profession. Don't just give someone a command. Don't just give someone something to do. Give them the reason why they're doing it. If you give someone the reason why they're doing it, there's a 90% better chance they'll do it, unless they go on a suicide mission, and that's understandable too. But anyway, so what are the barriers? If you look at the risk of dying, and I talked about extensively this morning, people who get an emergency are obviously at a higher risk of doing poorly than people who aren't. People who are older are at a higher risk of not doing well, and that's because, as I said earlier, life is a sexually transmitted, incurable disease, and the older we get, the more chances we have of not doing as well, but that's a fact of life. Women on dialysis do more poorly than men do because everybody tries to do this one-size-fits-all thing about KT over V's, which don't get me started on. But the point is that if you try to dialyze women the same way as men, they won't do as well. And so women have a higher mortality rate. They addressed that very, Straub talked about that yesterday. The Carlson Comorbidity Index and the surprise question. People also don't do as well if their index is higher. But the most, three times worse, your incidence of doing poorly is 3 times as high if you don't communicate. If you don't like your doctor, get another doctor. We're a dime a dozen. Gosh, there are a million of us around. And, there's not a shortage of nephrologists. So if you don't want to talk to your doctor, get another doctor that you want to talk to. The other thing is, if you don't talk to your doctor's not going to read your mind, and they probably won't talk to you, and then you'll have a problem. No one will know about it, and then that problem will bite you or will hurt you. So that is the most important thing that you can ever think about, is that communication, or lack of communication, is very important. So who's at risk for poor communication? Well, obviously the people who've had a serious illness, who have like a stroke or have a medical condition, are probably the worst at risk. The elderly are at a higher risk. People who are nonverbal, people who are denying that they're sick, don't want to talk about it. Just leave me alone, doc. I'm in the middle of my soap opera, and why do you have to make rounds during my soap opera? My soap opera is very important. I said, well, so is your health. And so language barriers. What about language? People who have speak a different language than the nurses or the doctors do have difficulty communicating because they may not speak English well, and the person that's taking care of them also may not be able to communicate well to them. For example, if a patient is Hispanic, and the nurse may not be able to communicate, and the doctor may not be able to communicate because they don't have the skills to speak Spanish, and so that can create a barrier. Patients from Vietnam, patients from, we had a patient once, and he was from a small area in Africa, and that nobody could communicate with him except for his daughter. So basically, when I went around with him, I could say one word to him that he understood, and it was daughter. And I would say daughter, and he would dial his daughter on his cell phone, and we would talk. He was actually a security guard in his hometown, very well educated, smart guy. But he never learned how to speak English, and he was from Eritrea or some very small city in country in Africa, and I never learned how to speak that language. And the only way we would communicate was through his daughter, who was in the School of Public Health. So it was a lot easier to be able to communicate with her than him. So that's what you have to do when you're talking to people. So language barriers can be a really big problem. What is effective communication? The successful joint establishment of meaning wherein patients and healthcare providers exchange information, enabling patients to participate actively in their care, is an example of poor communication. This was written by the Joint Commission. Communication is talking to people, relating to people. This is effective communication. Two giraffes, they barely say a word to each other, but because they can maybe moan or grunt, but they get the point across really, really fast because they've spent 50 million years or so working out communication signs and signals. And so a giraffe actually communicates extremely well and without hardly making a sound. And the reason is they can send a look that lets people know that there's a problem. They make eye contact. They have lots of muscles and facial expression, as do we. And so body language is very, very important in communicating. That's one of the reasons I don't like the internet for communicating with patients. Like, the patient just looks sick, and they're looking at you, and they're saying, "How do you feel?" "I don't feel well, doctor." And you know that they're really, really sick, and you know just from looking at them how ill they are. They're communicating, but maybe not with their voice, but with their body. So effective communication isn't just what you're doing with the spoken word. It's basically how you're relating to people. To me, that's what communication is all about. And the other thing about communication is caring. If the patient doesn't care about their health or the doctor doesn't care about their health, that's a really bad combination. And if the doctor and patient both don't care, then it's a terrible combination. And basically, you as a doctor, me as a doctor, we should want to tell you everything we can. And as a patient, you should want to hear everything that I can tell you. And likewise, you want to tell me everything you can so that I have the information that I can take good care of you. And, we basically, I love my trips to Africa. This is one of the most enjoyable things I do, is go to Africa and take photographs, because they send such an important message back to what we do, we kind of forget our day-to-day problems, and we start thinking about what is going on. In Africa, it's life or death. I mean, if you're in the bush and you're a giraffe, and you look out over the horizon and you see a lion sneaking around, you know, that's information that within a few minutes could, you know, end your life. But likewise, what we don't think about is in the office, the medical office, or the dialysis or the transplant clinic, it's also life or death. The patient that doesn't tell their doctor about that little lump in their breast is basically sacrificing their life. And it's no different than if you're a giraffe in the bush. And so the healthcare world has a lot in common with the world we live in. And so it's very important that we understand that communication is necessary for survival. And it's a worldwide, very, very basic principle. It doesn't, no language owns this. It basically goes throughout the entire animal kingdom. I mean, you have to be able to communicate. In fact, when this dude is out hunting, the birds are flying overhead and they're circling around, and the animals, they don't see the lion or they don't see the cheetah, but they see the birds up ahead. Because the birds know that it's supper time, and they can communicate. The birds basically let them know that there's a predator close by, so they're on guard, they move away, and the whole bit. You know, these types of systems of communication that work out, and it's something that we need to work out too. We need to have a system worked out with the doctor, that you let him know when you're really sick, you let him know when you're sort of sick, you let him know when you just want information. And so what are some of the tips that you can use to communicate more effectively? Number one, be prepared with your questions. Do your homework. Go to Google, go to Wikipedia. You know, it doesn't matter what you show your doctor. Even if it's wrong, you can show him and he can say, oh, that's wrong. Where'd you get that? You know. So, but the fact that you've brought it up is a memory jog. So be prepared. Do your homework. Do your questions in advance. Organize your thoughts before you speak with your healthcare provider. Unfortunately, your doctor has a limited amount of time, and it shouldn't be that way, but that's reality. And the fact that it is means that they can't waste their time. They have to work smart. So make sure that when you're talking to your doctor, you sort of have a pretty good idea what you're going to talk about. You want to focus your questions so that he understands or she understands the important essence of what you're saying very, very quickly. Because in 2 or 3 minutes, 5 minutes, you can get something across that's just as important. You don't need to spend a longer period of time to get that message across. Then your doctor can spend more time examining you or working on your medical records or doing paperwork, filling out reports to the network, or whatever else your doctor has to do. That are also equally as important in terms of making sure that the care, regulatory needs, and all the other things that are important are being met. And the doctor isn't just there to talk with the patient. Unfortunately, the doctor has a lot of other responsibilities in the facility that are time consuming. And you're sharing with your doctor a lot of other activities. And so you want to make sure that you're really, really getting your doctor, you're getting the maximum from your doctor at that time so that she can move along to take care of things that are equally as important. And I could go over those too. You want to make sure that your unit's running smoothly, and you want to make sure that the water system works. So there are a lot of responsibilities that your doctor may have that you want to give the doctor the opportunity to take care of. So prioritizing your questions and concerns, taking notes, bringing a friend or relative to help you remember what was discussed. If that friend or relative is a family member, that may be valuable, because one of the questions you might want to ask the doctor are is this running families? Is somebody in my family have as much risk of getting this disease that I have? And the doctor might tell you yes, especially when you're first diagnosed, if there's been a change in your condition. Talking to your doctor about anything along those lines is critical, because that is important. The friend or relative is very important too, because you may be so upset about your health, about the fact that you've got a disease that's going to change your life, that your mind is totally blank. You won't remember a thing that you're being told. And your friend, that's their job, is to remember what you've been told. I know when I was first told that I had cancer in my lungs, my first response was, oh, not me. I looked at the x-ray myself, actually. Oh, that's somebody else's x-ray. But then the next thing I did is I became disoriented in a hospital that I trained in, MD Anderson Hospital. I trained at MD Anderson Hospital. So, I could walk through the walls at MD Anderson Hospital. And then all of a sudden, I'm disoriented. I have no idea what's going on. And so, luckily, my wife came up and listened to the doctor and got a message about what was going to happen. And gosh, I was totally out of it. I had no way of remembering, what was happening. And I can tell you, anytime you hear information the first time, it's very, very traumatic. Always have a friend, a relative, that's going to listen to and bring you back, because you're not going to hear it. Sometimes you're so sick. General tips on how you can communicate more effectively. Number one, say, don't say, hey, doc, this is a stupid question, because there is no stupid question. Every question is important. If it weren't important, you wouldn't be thinking about it, because it's something that is, it's not going to be intuitive. The answers to 90% of the things are not intuitive. And they're not easy. These aren't easy questions to think about the answer. These are things that are complex. And when you think about, if you read the history of medicine, you read some of the stuff, the crazy things that went on years ago, you know more medicine right now, I guarantee you, just everyone in this room probably knows more medicine than probably 100% of the doctors at the turn of the 1800s. You probably know more than they do, I guarantee you. So there's nothing that is a stupid question. There's nothing irrelevant. Everything counts. So there's nothing too simple. Your doctor will slow down, hopefully, and answer your question. And then the other thing is slow your doctor down. We have some doctors that make rounds in our dialysis units. They leave the motor running in the car. They come in. They've got these shoes like the kids have with, the roller skates on them. And they come through and they see the patients and, how are you doing, Miss Jones? And he's already down the other hospital. And then kids, when they come back the other side, fine. Oh, okay, good. And I think I've been guilty. We've all been guilty of racing through dialysis. We may have a conference to go to. Maybe one of the great doctors is in town from a major university that we want to hear at lunch. Maybe a free lunch, and maybe that we want to go home. Maybe we've been up all night. Who knows? There are many reasons why doctors rush. Some of them are human beings, and they have human emotions too. And so sometimes you got to slow them down. What I would do is, what some patients do when they see me coming, they play a little reverse psychology. I say, hey doc, you look tired. I say, yeah, I have been working since about 5 this morning. Hey, why don't you sit down and relax? I say, okay. Why don't you sit down by me and take a break here? And, yeah, sure, glad to do it. And, I sit down with her and say, by the way, I just wanted to ask you about such and such and such and such. Is it a problem? I said, oh no. He said, that's fine. He says, you're really doing well. I'm really proud of you. And, oh, thanks. Gosh, Doc, I was so worried about that. And, just that 1 minute conversation, sitting down at eye level with a patient makes all the difference in the world to them. And believe me, it gives me a break because my feet hurt, I'm tired, and, sitting down is a nice thing to do. So slow your doctor down. I think your doctor will appreciate it in the long run because it'll show that you care about yourself. And doctors, I know from my personal experience, we do things because we get a lot of gratification out of it. So it's gratification to see a patient doing well and a patient expressing the fact that they're doing well by showing interest in asking your questions. So slow your doctor down, and that's the first most important thing you can do to effectively communicate. how can you communicate more effectively? Ask. Don't ask, don't tell. I mean, that may come from a different world, but it works for us. If you don't ask your doctor, there's a good chance your doctor's not going to read your mind and know that you have a problem. Know what each member of your healthcare can do and cannot do, and ask some of the other people that are in the clinic, and make sure you're doing it at the right time. During put on and take off, the nurses are sticking everybody, and they're passing out meds, and they're doing all these things. May not be the ideal time, but after they put someone on and they're going to their break, and they come back to say, "Hi, Miss Tan, I want to ask you a question. And my doctor said this, but I didn't really understand what he said. Do you understand?" "Oh, yes, I understand perfectly. This is what your doctor meant." "Thanks, that's what I thought." And, just so talk to the other people on the team. And Dr. Desai made this slide. It's kind of clever, and it sort of goes over what the different parts of the caregiving team have to do. There are basically licensed practical nurses, licensed vocational nurses, there are registered nurses, and then there are certified nephrology nurses, and then there's the advanced nurse practitioner. And all of these have different skill levels when it comes to knowledge. They all have different levels of experience too. But the bottom line is the nurse is an outstanding source of medical information. The physician assistant as well is the outstanding source of information. And they can tell you things that your doctor didn't tell you, and they can offer a tremendous amount of support. Also, a lot of times the doctor is tied up, is preoccupied, and the nurse isn't. So you can say to the nurse, "Well, you can tell the doctor I want to talk to him about this problem, or I've been having this problem, and can I tell it to you?" And she'll tell the doctor, "Mrs. Jones is really worried about a private matter, and she would like to talk to you about it." There are many reasons why the nurse is very important. Dietitians, I don't know if you've noticed it, but dietitians know everything about food. And, we rely on dietitians. We do not run our dialysis units without dietitians. And so talk to them about anything with nutrition. They also have access to some of the best recipes. I don't know if you know one of the cookies the dietitians had out there, one of the booths. They were delicious. I ate too many. But anyway, they can come up with some good food. You go up to the doctor, and what are you supposed to eat? Nothing. If it tastes good, don't eat it. You go to the dietitian, and they'll tell you recipes and really help you with that. Social workers, they're more than just financial assistants. They're the ones that give you your quality of life test, which means, and if you go over that quality of life test, and you answer those questions honestly, and then you make sure that information gets communicated to the disciplinary team, your care will improve about 100%. I had one patient, and I would go by and talk to him, and "How you doing?" "I'm doing great, Doc. What do you think the Rockets are going to do this year?" And, "Hey, let's talk about the Texans too." When he started talking about the Texans, I should have gotten the idea that there was something wrong with him. And then he did the HRQOL, and it was terrible, I thought the guy was going to jump out the window, except we're on the first floor. And, so I went back and I said, "Gee, I had no idea that these kinds of problems were going on, And it was a totally different person." So the social workers are critical when it comes to your care, and they can do a lot to share information with the rest of the team. The other thing is you want to travel, and you should. They're the ones that will help you plan your vacation, your activities of daily living, your transportation, your emotional health. Social workers are a key part of the organization. So talk with your social workers. Technicians, now this is where Dr. Desai and I have a friendly disagreement. Technicians perform the dialysis treatment. They do a very, very good job. They do it under all of our supervision, but they're still outstanding. There are many dietitians that have been around forever, and they know everything there is to know about dialysis. Believe me. They can ensure that your dialysis is proper. They help with the supplies. He said dialysis technicians are not trained to speak with you about your medical condition. I changed that up. We are training our technicians to talk to the patients about the practical things that they should know about. They may not be able to get into some of the more the complex mathematical concepts concepts of the KTRV, but they can certainly understand what the KTRV is, and they can tell you whether you're drinking too much fluid, and whether you need to watch your salt, and whether you're eating too much phosphorus. And the reason we're doing that is many of the technicians are able to communicate better with the patients. Oftentimes you'll have a nurse, and they'll come from one part of the world, and the technician and the patient are both, they have the same culture, and they can communicate very, very, very well with one another. Whereas, if the nurse is English might be the nurse's second language, and the technician and the patient might have grown up in the same block, who's better to talk to the patient about what the problem is? And so, needless to say, technicians have become an invaluable member of our health team, and they do speak with patients about medical conditions. They encourage diets. They say, well, the doctor told me that I wasn't supposed to eat processed foods because processed foods had too many, they didn't have phytates in them, and blah, 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 blah. What the heck was he saying? He was saying, don't drink Coca-Cola. And, basically, they can talk to you on a level that is important. Occupational therapist and all of these people are critical when it comes to regaining motor skills if you've been incapacitated. Same with physical therapists. And these likewise are people. Pharmacists, we don't have pharmacists around with us in our facilities, but needless to say, it is important that we work to find out what the side effects are. So when your medicines are refilled, always, always, always question your medicines. Look at the bottle, read the bottle, look at the pills, identify the pills. The worst thing you can do is get the wrong pill. Nobody means for that to happen, but mistakes happen. They happen every day. Malpractice suits happen as a result, and it's 100% needless. When there's a malpractice suit, and I can find out about it, I always want the patient to be involved in the blame, because this pill, you're the last person that pill goes in the mouth of. And it's your responsibility to make sure that just because some doctor made a stupid mistake, a pharmacist made a stupid mistake, and everyone else made a stupid mistake doesn't mean you have to be stupid too. Look at that pill. If your doctor didn't prescribe twice as much of that medicine, or something, he didn't tell you he was going to change that pill, and that pill's different. Say, hey doc, I noticed this Diaban is brown, and the last one was pink. And say, oh my God, that's the 320 and older to 80. Ooh, that's the wrong dose. Don't take that. And the patient is the one that would have been the one to tell you. You might have written for Diaban 80, and somebody made a mistake and made the one that's, and you know because you were taking it before. It could be just a generic brand difference, but you always question. And, I can go to my iPhone, or, go anywhere on the internet and look up a pill, even if it's generic. So always, always talk to your doctors. Talk about herbal meds. Some of these herbal meds will kill you, and they can be really bad for you. Some of them are wonderful, so always talk to your doctor and your pharmacist. Talk to them about prices. If the price of a drug goes up too high, maybe it's the wrong prescription, or maybe there's a cheaper brand that will do just as well. The secretarial staff is really important too, and be sure you're on good terms with them. I found out the secretaries can make or break a dialysis unit. There's such a thing as a workaround. You go into a dialysis unit, you need form, you need this, you need that. We're a very regulated group, and there's a lot of paperwork, there's a lot of things that we have to do to meet regulatory needs. And, some of these regulations are very, very important. And so when I'm seeing a patient, I know I have to fill out a form, that all the paperwork has to be there. If that paperwork's not there, I have to go look for it. That takes time. That's wasted time. So I call that a workaround. Anita Tucker at Harvard University School of Business also called it a workaround. And she wrote a paper on it and talked about how many millions of dollars was spent because people had to go look for things that they should have had ordinarily. So secretaries are critical to a dialysis unit. Use them wisely. They can help you, and they can help the facility a tremendous amount. So they are very, very important. Anyway, the physician-patient relationship has been around forever. This guy, Dr. Desai, says the modern physician is ill-equipped to assist patients with every aspect of health care, and neither the physician or the patient admits to this fact. Well, I don't admit to it. Maybe I'm old-fashioned. I feel that the buck stops with me. I'm responsible if something happens in that dialysis unit. And as a doctor and as a medical director, I take that responsibility very, very carefully. And I feel that I have to become, if I am ill-equipped, then I need to become better equipped. And the physician, the modern physician, the reason why we have more errors, the reason why we have a $14 trillion healthcare bill and other countries have a fraction of that is maybe because our physicians are ill-equipped, and that may be the problem, not the solution. The solution is that the modern physician needs to become better equipped at understanding and communicating with his patient. And it's important we use our resources wisely. The internet is replete with information. I would start with AAKP. I would also go to the Kidney Foundation, to the National Library of Medicine, PubMed, to the National Institute of Health, to nephron.org, to Wikipedia and Google. I mean, wherever you go, you can find information. Is it the right information or not? That's up to you, because one size doesn't fit all. Just because you learn something from the web or from Good Housekeeping or a magazine doesn't mean it pertains to you. Always bounce that information back across your doctor. And social media is for social. I mean, Roberta, who worked with me since I started with dialysis, gave me my flu shot. We put it on YouTube, and we did it in the middle of the dialysis unit. We made a big deal out of it because I wanted people to know that I was going to get a flu shot, that it was safe, and I wouldn't tell them to do anything that I wouldn't do myself. But it ended up on YouTube, and, we loved it. It went all over the world, and we had a lot of fun. But basically, that's social media. Some people think they should communicate with their doctor by email. I do not. I don't communicate with my doctor by email. The only thing I do by email with my doctor is I'll ask for referrals for friends of mine who have cancer, and I get a referral every week. I find somebody that I need to refer to him, or we talk about photography, because he's a Canon man, I'm a Nikon man. We talk about photography, and but I do not do anything with respect to my health over the internet. I don't think it's the appropriate thing to do. First of all, my doctor has been up since 6 in the morning. He's home at 9 o'clock at night. He needs to get caught up on his journals. He needs to get reacquainted with his family. The last thing he wants to do is when he checks his email, start to read, 10 histories and physicals that, and try to come up with medical decisions that we should have been seeing him about during the day or talking to him about during the day. So I think, first thing, I think it's selfish to try to communicate with doctors by email for routine things. If it's an emergency, I think that it's also inappropriate, because I guarantee I haven't checked my email all day today, and I don't expect to check it all day. I'm here talking with you all. So if somebody really had an emergency, they need to make a phone call to my answering service. The person who's available needs to take care of them emergently. So I may have some people may feel differently, but I don't feel email is, just because it's there doesn't mean it's an appropriate way to communicate with your doctor. Twitter, of course, Twitter is basically a joke. It's a way to, it's kind of a social thing. Facebook is a very good way to communicate and get information, but not about your personal health. It's a way to, just get general information, recipes, good tips. A nurse may want to put something on there about, emla cream, or about how to stick a fistula. Don't listen to it, talk to your doctor about it, but needless to say, LinkedIn is great for people with professionals who want to change jobs. Usually when someone invites me to join them on LinkedIn, it means they're going to change jobs. YouTube is fun. I love YouTube, but it's not a way to communicate about your health. Don't put a picture of your rash on YouTube. Foursquare is a way you can communicate by your cell phone. This is my website. You can see I wear my hat so I can prevent skin cancer. I put Adele's Rolling in the Deep on there, but it's mainly a social site. I mean, this is how we communicate about, show pictures of grandkids, pictures that we took at weddings, birthday parties, stupid things like that, vacations. It's not, there's a social, and then there's medical, and there's work, and then there's play. And I really think that when a doctor is working, he should be working. When he or she is playing, they should be playing. I don't think Facebook is a place to go for, communicating about your personal life. And I've talked to some of the owners of Facebook about that, that are friends of mine through family, and they basically told me, don't use Facebook for communicating because we're not HIPAA approved, we're not encrypted. We give you privacy on your groups, we'll give you your password, but we're not encrypted, and we're not encrypting patient information because we deal with 700 million people, and it would be impossible to encrypt 700 million things like they do. I mean, they would have to have servers the size of California if they did. So it's an appropriate place. There are groups on dialysis groups, people can talk about, this person says they're taking a shower with peritoneal dialysis. If they're going to take a shower, then, maybe you need to talk to your doctor. But the important thing is it's not HIPAA secure, and you don't want to violate the federal laws because it's not necessary. So with respect to electronic communications, discuss it with your healthcare provider. It's public, it's not encrypted, it's password protected, but definitely not encrypted. You do not want to put your latest HIV results on. Delayed response. I'll check my Facebook tonight. I did have a patient who contacted me on Facebook once because they tried forever to get their doctor, and their doctor wasn't communicating with them, so they basically sent me a message on Facebook, hey doc, would you get a chance, call and set up something so that either I can get in touch with the doctor that I'm supposed to be talking to, or so we took action on it. Email, cell phones. I had patients call me on my number. They have my caller ID. I don't mind patients calling me on a cell phone if it's important, and they do. They respect that. And during the hurricane in Houston, I had 1 million cell phone calls because everybody's meds got wet and they needed new medications. And I loved it. We saved lives through the cell phone. And when there's a tragedy or a disaster or something, all's fair. It doesn't matter, but it's important. Also, when you call a nurse or you deal with a nurse on Facebook or you deal with a nurse after hours, we've been told that violates employee regulations for salary providers because they're actually that's a work-related thing and they're not getting paid for it. It creates all kinds of problems. It also doesn't make the medical record. Usually your conversations in the email may not make the medical record, and it may be something that's really important that might have changed your care. So I always have my patients call the office. It's documented in the medical records. My staff calls me immediately, and I answer the patient immediately. If I don't answer the patient immediately, I haven't done my job. And doctors answering emails at night, to me, the nighttime, unless you're on call, you should be spending that time with your family. If not, you may not have a family. And then the doctor loses his family, and then he's in a bad mood the next day for the next year. So it's important that the doctor have a chance to have a family life and also get caught up on his journals. And if the doctor's not reading their journals, and they don't have any excuse to be a doctor, so they really need to keep up with the medical literature. And it also violates privacy. You don't want your conversation shared, and there's a bunch of college kids looking at servers, and they're saying, hey, look at that one. And you don't want that. And your information is private, and people need to respect your privacy. And the best way for them to respect your privacy is to keep it off anything that can be public. So anyway, a doctor or a practice may have a Facebook page, but that's basically FYI. It's mainly a marketing tool. The take-home messages here are that communication is a right, not a privilege. And you have a right to communication. And there's no way around it. And if you're not getting communicated to, if you're not communicating and the system is failing, and you need to fix it, and you need to take the charge of making sure that your doctor or your next doctor fixes that problem. Without communication, there is no cure. I don't care who you are or what you are trying to do. If you're not communicating with your patient, and the patient's not communicating with you, you have a terrible relationship. Unfortunately, it's still a relationship in the eyes of the doctor has a duty, but as far as I'm concerned, that duty is being breached if there's not communication. The health team can be very helpful. They don't replace the physician, but they're very, very important at supporting the physician. Balance your expectations with your limitations. There's limitations to what your doctor can do. There's limitations to your doctor's time. There are realities regarding that, and so you need to limit your expectations of what your doctor can do. Your doctor is not, or should not be, just like a parent. I mean, I am not friends to my children either. It's not so much a friend. Your doctor is a professional person that you rely on for information. And then finally, use the internet for information and use social media socially. And that's the end of my